One of the workers' most important tasks is to help groups develop dynamics that promote the satisfactions of members' needs while facilitating the accomplishment of group tasks. The development of helpful group dynamics is therefore very important. And this group dynamics comes in different stages. The first stage is the planning stage, followed by the assessment, and the third is the middle stage. This discussion will focus on the middle stage. During the middle stage, groups are focused on accomplishing the objectives, goals, and tasks developed earlier in the life of the group. It is assumed that by the middle stage, workers have already discussed group's purposes, developed a group contract for confidentiality, attendance, and number of sessions, and developed individual contracts with particular treatment goals for each members. In a group task, there are two kinds of groups, which is a treatment and the task group. So we take here discussion in the treatment group. The middle stage of treatment groups is characterized by an initial period of testing, conflict, and adjustment as members work out their relationship with one another and the larger group. When these testing, conflict, and adjustment occur in the group, these are signs that members are becoming comfortable enough to assert their own needs and their own vision of the group. So in this, they can be comfortable already to oppose their ideas, to give their ideas, even if they oppose or they give opinions already, and that means they are on the way getting comfortable with their group. Although every group has a unique developmental pattern that calls for different leadership skills, workers are often expected to perform seven broad activities during the middle stage of all treatment groups. These activities include preparing for group meetings, structuring for group work, involving and empowering group members, helping members to achieve goals, using empirically based treatment methods, working with reluctant and resistant group members, and monitoring and evaluating the group's progress. The first activity is preparing for group meetings. During the middle stage, the worker should continuously assess the needs of the group and its members and then plan to meet identified needs in subsequent meetings. The cycle of assessment, modification, and reassessment is the method by which the leader ensures continued progress towards contract goals. The second activity is structuring the group's work. Structure refers to the use of planned, systematic, time-limited interventions and program activities. So what should we do to be able to structure the group? First, inform the members about beginning and ending the group on time. Like for example, you would say this meeting, this session will last for 1 hour only. And then give attention to apportioning time for ending meetings. Okay, so we have to say there is already 15 minutes break, or after 15 minutes we'll be through with this session. Set agendas, it's either verbal or written. Then establish and maintain orderly communication and interaction patterns. So as a worker, we need to know how to make traffic in the communications of our members. Next, we have to help our members progress towards their goals. So we have to assist them. We have to be there because even if you are the worker, we are there as facilitator. Then attend to the transitions between group activities. Okay, so you just don't give don't you just don't shift to the next activity. Instead, we have to make a transition. Then focus on multi-level interventions, whether it can be for the individual, it could be for the group, or for the environment. The third activity is involving and empowering group members. So how would we do that? The very first step that we have to do is to believe that they have the strength. Okay, to show belief in members' strength that they are capable, that they have the ability to do it. The second step is to acknowledge difficulties and obstacles encountered in attempt to reach particular goals and objectives. Because our members are not perfect anyway, but we have to acknowledge their difficulties. The third step is to help them know that they have a stake in the content and direction of the group, that they have part, they have the use, they can contribute something for the group. And the fourth step is to praise members for reaching out to help each other, of course. The next activity, helping members achieve their goals. So it is very important that these members know the goals of the group. So they must be able to understand where they are going, and by that they will see the relevance and significance of having the group. And also, we have to develop a treatment plan as to who needs this one, what is needed here, when, where, how, when, and what. So, in developing the treatment plans, there are intervention roles that we have. Once we identify our intervention roles, then we would know what particular treatment we are going to plan and develop. The first one is being an enabler. It helps members utilize their own resources and strength, encourages members to share their thoughts with the group, support a culture of mutual aid among members. So, if we encourage them to share their strength or their resources, they would feel they are important. They would feel they belong to the group. And by that, there would be a mutual culture of helping each other. The next one is a broker. So, a broker identifies community resources that may help members carry out their treatment plans, connect members with these resources. Like, for example, we try to contact other agencies that can help our members in their treatment plans. Like, for example, we invite an expert to do the activity. Another role, intervention role that we have is being a mediator. So, obviously, a mediator resolves disputes, conflicts, or opposing views within the group or within a member and some other person in the organization. So, a mediator takes a neutral stand and helps members arrive at a settlement or agreement for the group. The fourth one is being an advocate, represents members' interests and needs, helps members obtain services and resources. So there are some who are still shy to talk. So you, as an advocate, you bring them there to the group. The last one is the being an educator. Being an educator represents new information to help resolve members' concerns, demonstrates and models new behaviors, lead role plays, simulations, and the vivo activities to help members practice new and different ways of behaving. The next activity is using empirically based treatment methods in therapy groups. One problem for the practicing group worker is that groups are often not made up of members with just one type of mental health or other problems. So it is just very important that we use the correct approach appropriate for our members. So here are some cognitive and behavioral evidence-based therapies for treating mental health problems. So here are 10 different cognitive and behavioral evidence-based therapies for treating mental health problems. 1. Beck's cognitive therapy. 2. Problem-solving therapy. 3. Rational emotive behavior therapy. 4. Acceptance and commitment therapy. 5. Behavioral activation therapy. 6. Dialectical behavior therapy. 7. Cognitive analytic therapy. 8. Positive psychology and therapy. 9. Mindfulness based cognitive therapy. And lastly, emotion focused or interpersonal cognitive therapy. The next very important activity, because we could not deny that there are people who are reluctant and resistant group members. So, what do we do here? So, we have to see that this is a very important activity that we have to bear in mind that they have the right to refuse to participate. So you point out consequences of refusal and clarify non-negotiable aspects of participation. And last but not the least is you have to monitor and evaluate the group process. So we should not forget before we end the middle stage, we should give a session for evaluation. So by that, we end our discussion here on the mental stage on treatment groups. Thank you.